Hi, I'm Shannon Rotolo. I'm a pharmacist at the University of Chicago, and today I'll be sharing the poster Virtual Medication Tour with a Pharmacist as part of a cystic fibrosis telehealth visit. During spring of 2020, as a result of the COVID-19 pandemic, a number of appointments for ambulatory care services throughout our institution were converted to telehealth. In our adult cystic fibrosis clinic specifically, we still incorporated the full cystic fibrosis multidisciplinary team, including a pharmacist, into these telehealth visits and included most of the previous workflows used, meaning that our pharmacist would continue to do the medication history, reconciliation, assessment of adherence, assessment of efficacy, and of any side effects of medications that patients were taking. But in addition to those routine services, we also incorporated something new, a virtual medication tour. At the start of a telehealth visit for patients seen in the adult clinic over the age of 18, the pharmacist would ask patients if they were willing to provide a virtual tour of their medications using whatever device they were already participating in the telehealth visit with. And they were prompted to show areas of their home where medications were stored through that video communication device. And the pharmacist would assess whether or not those storage conditions were appropriate, looking specifically at temperature, humidity, and light exposure in areas where medication was stored, and whether or not they were within reach of pets or children. Our primary outcome for this pilot project was to determine patient willingness to participate in virtual medication tours. And our secondary outcome was to identify any potential interventions that could be achieved by incorporating this practice. Of the 20 patients that were seen in the adult cystic fibrosis clinic during this 3-month pilot period, they were a fairly similar sample to our overall clinic in terms of age, in terms of race, and in terms of genotype. You'll notice about half of patients that were included were heterozygous for the F508 deletion, which is the most common mutation in cystic fibrosis, with another relatively large proportion being homozygous for that most common mutation. The range of medications per patient was anywhere from 9 to 32. Based on other data in the cystic fibrosis population, we know that a typical number of medications for a patient is usually around 10 to 12. Of the 20 patients that were seen during this time period, 5 of them had missing information in their medication list in the electronic medical record, specifically about an over-the-counter medication or a supplement. This was often because these were patient-reported meds rather than something that had been prescribed for them. So perhaps a specific vitamin or supplement or protein drink that was purchased at a store that was a specialty retailer of these type of products. Through the virtual medication tour, in almost all cases, those were able to be updated on the medication list. So 4 of those 5 patients, that information was able to be added in terms of specific ingredients in those supplements or dose of OTC product by the patient showing that to the pharmacist over the screen if it was something that wasn't already up to date on their list because they perhaps had not brought that bottle into clinic before or provided that information. We're also interested in looking at whether or not patients had all of their needed medications on hand. With the pandemic itself, in addition to disruption in the post service, the United States Postal Service, in addition to some looting events that took place during social disruption over the summer of 2020 in Chicago. This was something that was important to us to be able to check to make sure people actually did have the medications they needed at home. 100% of our patients did have all medications that they needed in their home. And in terms of discrepancies between the electronic medical record medication list and what patients were actually using at home, we did identify one patient who was on a medication that was not previously recorded in their EMR. In terms of storage, a majority of patients were storing medications appropriately. 100% had their medications stored in the refrigerator if they did need refrigeration. No one was storing medications in a particularly humid area, and a majority of patients were using some sort of medication organization system, whether that was a weekly or monthly pill container, or more commonly for this cystic fibrosis patient population, a storage cart or a cabinet or dresser based on the large size of some of the devices that go with their nebulized therapies. We did, however, find that in the 4 patients who had children under the age of 12 in their home, 3 of them were storing medications in a place that would be easily accessible to those young children. Based on these findings, we determined that it would be important for us to provide additional poison prevention education to all of our patients of the both adult and pediatric cystic fibrosis clinics via a webinar as a follow-up step. There were some limitations to our study in that we did not include the location patients were at during their telehealth visit. Of the 7 patients who declined to participate in the tour, a majority had in a notes section of the data collection form that they were either in an office or workspace or staying with someone else in a household where they didn't feel the storage of their medications accurately reflected their usual practices or habits. If we'd included this in our data collection form and had this information for each patient, this would be a bit more informative in terms of reasons for declining that visit or that virtual medication tour. Last, our sample size was smaller than anticipated, even being a relatively small adult cystic fibrosis center with less than 100 patients. And this was likely due to either delayed or skipped quarterly visits during the early 3 months of the COVID-19 pandemic. If you have any questions, I'm available at Shannon, SHANNON, .rotolo, ROTOLO, at uchospitals.edu. Thank you.